everyone. Today we're going to be going through Hepatitis B Serology Interpretation and having a go an AKT style question on the right. Okay, so firstly, on the left, you can see all the different antigens and antibodies that can be found and present in hepatitis B serology. So the first one, the Hep B surface antigen, is always present if there's an active infection. The anti-HBC core antibody will be present if there's an ongoing or a previous or an ongoing infection. Anti-hepatitis B surface antibody will only ever present if the patient has been exposed to the surface antibody via vaccination. IgM antibodies are present during a acute infection, whereas IgG anti-hepatitis B surface C antibodies are present if there's a chronic infection that's been going on for more than 6 months. And the anti-hepatitis B E antibody will be present if there is viral replicability. Okay, so let's have a look at the question on the right. Okay, so a 24-year-old man who works as a nurse has presented to the hospital with abdominal pain in the right upper quadrant. He also reports having stabbed himself with a cannula whilst cannulating a patient during a shift at work, developing weeks later yellowing of the eyes, fatigue and general malaise. Whilst upon palpation he has a large distended abdomen with mild hepatosplenomegaly. He is sexually active and reports no recent travel abroad. The nurse takes his hepatitis B serology and reports the following findings. Given the above results, what is the most likely diagnosis? And we've been given a series of answer options. Okay, so the fact that the nurse has stabbed himself with a cannula suggests some kind of transmission of bodily fluids via a needle, such as blood. He also shows other non-specific signs of hepatitis B, such as the jaundice, the yellowing of the eyes, the malaise, the fatigue. He's sexually active, which is another mode of transmission of hepatitis B, and the fact that he hasn't reportedly travelled abroad recently would rule out other types of hepatitis, such as hepatitis A. So now let's have a look at the serology. So the HBS antigen is positive, so that suggests he has an active infection. The anti-hepatitis surface antibody is negative, so that suggests he hasn't been vaccinated, and therefore that would rule out answer option D. We could also rule out answer option C because we know he's not immune due to lacking the antibody. The anti-hepatitis C core antibody is positive, so that suggests he's either got a previous infection or he has an ongoing infection, most probably an ongoing infection due to the fact that his hepatitis surface antigen is positive. The fact that his IgM anti-hepatitis C core antibody is negative suggests it's not an acute infection, and therefore the current and ongoing active infection must be a chronic infection. Especially this is going to be confirmed by the fact that he is positive for the anti-IgG anti-hepatitis B core antibody, which only presents if there is a chronic hepatitis B infection that's been going on for more than 6 months. So then that would make me rule out C, B, leaving the answer option being A. Thank you.